new legislation that will change this bubble diagram. We'll have a couple of new committees falling under the board, and some changes to existing committees, to at least one existing committee. Of the current committees, we have 165 membership positions among the board and its current 9 committees. We have approximately 130 current members serving on the board and its committees, although these membership numbers are continually changing as terms end, members transition, and we have legislative changes. We'll share a little data in a couple of slides, which will be based on a snapshot in time from last fall. So 165 on this slide. You might see different numbers on the other slides, given that things change. So one thing to note is that the membership of each of these committees is set in different ways. So there are, let's see, 3 committees that are in blue that are established by the governor, 4 committees in yellow or orange that are established by, where membership is established by the policy board, and 2 in red, which are where members are established by OHA. So let's see, let's go ahead. I just want to acknowledge that the 165 members of the board and its committees dedicate their time and expertise. This is a full workload to address emerging work areas and statutory requirements. So there's a lot of work happening under these committees. So as we think about what it takes to establish committees that are effective and have representation across all the aspects of subject matter expertise and diversity, demographic representation, I wanted to share a couple of examples for how staff might be considering, and the chairs and the policy board and others might be considering how to fill those slates. So this is an example that Brenda Johnson from the policy board shared with us as part of this work that is used in a board that Brenda sits on. So when the board is considering its members, it looks at the knowledge and experience representation that they desire to carry out the work of the board. And in this case, that includes areas like clinical expertise, population health, insurance and risk, et cetera. I want to call out one thing on this I liked a lot was sort of the third green box in is lived experience as a knowledge and experience priority for that board. And then separately is also considering demographic representation, race, ethnicity, age, gender identity, language, disability, and sexual orientation. And it's really the matching up of the those 2 wheels, so to speak, of representation that is considered when looking at new members and recruitment. So when we think about the policy board and its committees, there's knowledge and experience representation needs, there's demographic needs. In many cases, committees may have statutory requirements for the sectors or stakeholders to be represented. In some cases, there are seats that are specifically designated to specific organizations or sectors, or even designated to be to kind of belong, that seats that belong to a specific association or organization for them to appoint. So those, those factors make this kind of a complex puzzle in identifying an ideal committee or for the board, or for the slate to present to the board or to recruit. So this is a great example, I think, of a tool that could be used to identify gaps in current members and to target recruitment. And often as staff, we look for members who can bring multiple perspectives to bear. We have a limited number, typically that number of members is set in the statute or charter. And so we're trying to complete this puzzle with those limited number of seats. Next slide. The next example I wanted to share, you saw in the July board meeting, is what we put together for recruitment for the Health Information Technology Oversight Council, where we looked at areas that are set out in statute, which are here represented by the green bubbles for committee membership. We looked at requirements from our charter, which is set by the policy board, that are the blue bubbles. And then we identified the work ahead for HITOC and its priorities, and demographic representation as another dimension, and that's represented in the orange bubbles. We used this kind of diagram to identify where we already had members filling these roles and where we had gaps that we needed to fill. In conversation with HITOC, the chairs, our policy board liaison, and our staff, excuse me just a sec. We went through a identification of gaps and identified where we needed to target our recruitment. We also used the Division of Equity and Inclusion gap analysis process, which helps suggest an ideal racial, ethnic, and geographic makeup for our committees, and incorporated additional demographic data that we found to incorporate that into our gap analysis as well. So I just thought it'd be helpful for you to see, as we think about committee membership recruitment and retention, some of the different ways that staff can be looking at identifying what's needed and where the gaps are. Next slide. So one of the things that Ignatius points out in the analysis and the background research is that the policy board and its current 9 committees are vying for committee members, excellent committee members, who may be considering other committees. We have over 200 committees that are staffed within the Oregon Health Authority. There are dozens of healthcare and public health boards, commissions, councils, advisory committees, and task forces. Outside of the Oregon Health Authority, there are other boards and commissions, especially as we're thinking about demographic representation. There are other boards and commissions that are focused on Black, Indigenous, people of color, American Indian, Alaskan Native communities and populations, and many are recruiting for new members. So we'll have a nice compendium in the report of all of the different committees that are out there that we're kind of competing with for members. Next slide. So I also wanted to flag, we have done some additional preliminary analysis of the committees, current members of the board and its committees, and the practices around collecting demographic data across committees. So a few highlights to share. While we have the most comprehensive data on the policy board and committee members for race and ethnicity and geography, those data are not uniformly collected across our committees. So staff use different questions, have collected, categorized geography in different ways, for example. And so we've done some analysis for the October policy board meeting, compiling that information. There was also a Real D anonymous survey that was collected last fall of committee members. But ultimately, we are, in some cases, comparing apples to oranges. Not all committees have collected data on primary language, disability, gender identity, and sexual orientation. And no committee, this is no committees, it should say only one committee, which is the Health Equity Committee, collects data around an applicant's or members' expertise in equity, diversity or inclusion, and lived experience. And right now, none of our committees are collecting data on age. So as we think about the missing representation on the committees of the board that was highlighted in that charter framing, that we need to ensure that we have committee members that bring an expertise in equity, diversity, and inclusion, for example, we don't know the answer to that question for the vast majority of the committees. We're not asking that question. So this graphic is from the October board meeting, and it shows that across all the board and its committees, we have members that compare to the population of Oregon based on the census. So you can see that we have, in some cases, more American Indian, Alaska Native, Asian, Black, or African American members than across our committees as a whole than would be the proportion for Oregon's population. We have fewer committee members that are Hispanic or Latino, Latinx, or white as compared to the population of Oregon as a whole. So the actual demographic makeup varies considerably by committee as well. So this is just showing you kind of the overarching demographic makeup from a race ethnicity perspective. All right, and next slide, and then I will switch it over to Ignatius.
Thanks.
The last piece I wanted to mention was the preliminary analysis we did to look at the representation by sector. So we identified that across all the committees of the board, we have at least 25% of members represent healthcare payers. About 18% of members are provider representatives. Consumer, tribal, and other groups have very low representation. You can see we have about 3% consumers and 2% tribal representatives across the committees. And there are some others called out here. We also look to see where we have the same organizations with representation across committees from the same organization. And we have several organizations that have representation on multiple committees. So this analysis is very preliminary. Many times a committee member wears multiple hats. So this will be refined, and we may need to do additional data collection to have a final analysis on this. And I will stop there.
Thank you so much, Susan, for all that information. I just want to take a moment to see if there are any questions or comments from members before Ignatius continues this morning's educational webinar. I'm not seeing any hands up. I'm not seeing anything in the chat. Okay, just for a friendly reminder, we will take questions throughout if they pop up. It sounds like we're ready to move on. So Ignatius, please begin when you're ready.
Great. Thank you, Tara, and thank you, Susan, for that overview. So what I'm going to do is now, as it's becoming clear, hopefully this really is a puzzle. There are multiple parts to the puzzle, and I think one of the things that we've learned in this process is that we really need to take a much more systematic approach to committee member recruitment and retention, and ultimately to diversity, inclusion, and equity. And that while this has been a responsibility for the lead staff of the committees, this process, by chartering the committee membership work group that then draws on even other parts of OHA, has really, I think, helped the staff think about this in a much more systematic way, and then think about solutions that, again, are going to be supportive of everybody's work moving forward. So in doing then the root cause analysis and the gap analysis, I pulled the lens out even further, first just to say, to try to dispel the myth that Oregon is not very diverse racially and ethnically, that our latest census data shows that approximately 30% of Oregonians are in fact either BIPOC or Asian American Indian and Alaska Native when we're including Hispanics and Latinos. And that diversity will continue because the public schools are reporting that nearly 40% of the students that are in public schools our young people are increasingly diverse, and so that diversity will increase throughout the state. At the same time, we also know that when we're specifically looking at who is served by OHA, especially through the Oregon Health Plan, the Medicaid program, that right now the data that we have is not very good because about half of the data is missing, but that data also shows a significant percentage of Oregon Health Plan members are also from these communities of color. And so in that backdrop, we also understand, next slide, that because of systematic racism and the other structural barriers that racial and ethnic communities and populations have faced, that the opportunities for education, for employment, particularly in the health professions and other professions that we would draw on for committee membership, have also impacted that pool of potential applicants and potential committee members. And so we're going to be in the report detailing a little bit about the lack of racial and ethnic diversity compared to the Oregon population as a whole in Oregon's health professions, and particularly among Blacks, Hispanics, and Latinos, American Indians, and Alaska Natives. And we're going to look at, for example, physicians, nurses, social workers, and dentists, who again might be the kinds of folks that we would want to be committee members to represent not only their health professions, but the communities and populations that they serve as health providers and health professionals. And then finally, layered on top of this, we also know that there's tremendous geographic diversity in the state of Oregon, and that there are significant and ongoing and chronic shortages of providers, particularly in some rural areas. And so to try to add a geographic layer to this makes it even more difficult and challenging. And yet again, I think it's something that we have to consider, that we don't want all the diversity to be reflected from the Portland metro area. We want to be identifying diverse members racially and ethnically from other parts of Oregon as well. So as Susan mentioned, I was also able to talk to some both external stakeholders as well as what we're calling internal stakeholders, next slide, about this process. And we're going to continue those conversations as we finalize the findings and recommendations in the report that we'll be presenting at the August 3rd meeting. But just a brief summary of some of the external feedback, and this includes feedback from health professional associations, provider associations, as well as some of the regional health equity coalitions and some of the organizations representing the Black, Indigenous, people of color communities in Oregon. And so the good news is that the external stakeholders were all very aware of OHA and the Oregon Health Policy Board's prioritization of health equity, and all were very eager to partner with OHA on any recruitment efforts to the extent that they could be helpful. But they did say that they needed more ongoing engagement and support, and in some cases, particularly from the regional health equity coalitions and some of the community-based organizations working with communities of color, that there also needed to be some trust built before they felt like they could really engage in this effort. They definitely said more accessible, user-friendly, more systematic information about the committees and their work and vacancies, needing time to work on recruitment and partner on recruitment would also be really useful. Next slide. The external stakeholders also said that they had some specific recommendations. What was really interesting was that many volunteered, that they themselves were engaged in diversity, inclusion, and equity efforts, and they saw those things as aligned and dovetailing. Some said, for example, that they saw this as the future of their organizations, that many of their younger members were really concerned about these issues and the lack of diversity, equity, and inclusion in the association itself. And so to the extent that they were promoting these efforts within their organizations as well as partnering with OHA, saw it in their organizational interests as well. Some had some specific recommendations about overcoming those challenges to diversity in rural areas that I mentioned. Also for retaining committee members, again, from their own experiences, serving on boards and committees, of how more diverse members, underrepresented members historically can be supported and retained. And then obviously by opening up this conversation had some other comments about committees in general and how they operated in OHA in general, and its work on health equity, which will also include to respond to those suggestions and recommendations as well. And then in terms of the internal feedback, as well as from some of our sponsors, next slide. Similarly, there was a strong commitment to this goal of increasing the diversity of members. But again, that up to this point, this had been seen as much more of a committee by committee task. And I think everybody now sees this as a much more systematic challenge, but also that the solutions are going to have to be systematic, that there's going to be need for standardizing processes, data collection, making sure that there's that transparency and some degree of accountability ultimately across the committees, rather than every committee sort of struggling with this by itself. Next slide. Many stakeholders also talked about, although we had focused on racial and ethnic diversity in these conversations, that they were eager to see additional work on the other dimensions of diversity. And that's obviously going to take more work for us to explore and engage in stakeholders, for example, from the LGBTQ community or for the disability community, to get their input on these issues of how diversity, inclusion, and equity would work for them. And many are also anxious to move beyond what some people have called the potential tokenism of just diversifying committee membership without moving to more inclusive practices, and ultimately to committees actually having a greater priority and focus on equity itself. And so while that's a little outside of the charge and charter for the work group, we are going to begin to address some of those issues and then outline some recommendations to address that in the future. So finally, I just wanted to emphasize that we want to continue to work on this issue of lived experience, and we're proposing defining lived experience as based on one's self-reported racial or ethnic identity or other identity. So for example, to use myself as an example, I'm Chinese American, I identify as an Asian American, but my experience is also not just from my life, but from the fact that I've worked for an Asian American, Native Hawaiian, and Pacific Islander organization. I've been on boards. I've now been a consultant to about a dozen of those organizations. And so I have a lot of experience, not just based on my identity, but also on my experience. And then we also do want to recognize what we're tentatively calling cross-cultural experience. So someone who's lived or worked or learned about other communities and populations that's different from their racial or ethnic identity. And so again, using myself as an example, I've done extensive work in the Latino community. I've learned Spanish. I went to language school in Guatemala for a month and have represented a whole variety of Mexicans, Central American, and other immigrants and refugees in my professional work, and have worked with a lot of Latino health organizations as well. And so that's not how I identify, but I have a certain degree of cross-cultural experience in the Latino community. And so this is the kind of nuance and information that we aren't asking or tracking, and we're going to need to develop what are the right questions to be able to document this and then track this over time. Next slide. So Again, what I already alluded to this, we have focused in this first phase on the racial and ethnic dimensions of diversity, and we recognize that we have to do this additional work if we're going to provide more comprehensive recommendations, and we're going to begin that work this month before we present to the board, but we may not be able to complete that by August. Next. So then here's some preliminary findings that we will present more comprehensively in August. Next. First, this framework, which may be familiar to many of you, that diversity, inclusion, and equity is a continuum. It's not a linear continuum, that certainly having data about committee members and the transparency and accountability to show that diversity is increasing over time is an important element, but that ultimately in the second column, that the committee practices have to be inclusive of really listening to and engaging those communities that have been underrepresented and excluded, and that that experience is honored and really taken into account, and that we begin to really use that equity lens, for example, asking whether a committee policy being considered, or even just the process of how a committee operates to consider that policy, is being inclusive of those diverse perspectives, and has health equity as a framework. And then ultimately moving to equity, if it really is going to be a priority for OHA and for all the committees and the board, that really becomes the focus of the work, and that ultimately to get to the definition of health equity as OHA has defined it also means examining how resources and power are currently distributed and redistributing it in an intentional way to address those historic and contemporary inequities and injustices. And so that ultimately every process, decision, and policy is in service of equity and advancing equity. And so we're really at that very first column of examining how we can improve and increase the diversity of these committees and the work that the committees do, but that there's this much more comprehensive process that needs to be implemented over time. Next slide. And so some of the findings that we're going to be making are that we need a more coordinated and consistent process. We need more standardized ways of collecting demographic data. We need to recognize the barriers that stakeholders might face in becoming committee members. And so staff and OHA needs to engage with those stakeholders in a much more systematic way, build trust, and then build support when they are recruited and ultimately on committees, to also retain them on committees as well. Next slide. And then to preview a little bit, we will be developing then some recommendations for the board's consideration. So operational definitions, that more systematic approach to recruitment that will include data collection. We will be examining, as we've alluded to, many of the representation requirements are in the statute or charter. And so we're going to be examining whether or not there might be recommendations to make some changes to those statutes or charters so that diversity can be more easily considered. As Susan preliminarily shared, there's not a whole lot of consumer representation, for example, and that might be something that the board would want to make a recommendation for increases in the number of consumer seats, for example, that are designated by statute or charter, or to specify that those consumer seats are more diverse. That we need to also work on retention and engagement and other inclusive practices. And then a lot of this will need training, technical assistance, and other support, not only for OHA staff, but also for committee leadership, for chairs and co-chairs of committees, to have the support to be able to implement all this. And so finally, as Susan already mentioned, some next steps that we're going to be doing are finalizing these findings and recommendations in a report that we will present in August. We will continue doing some of this work, especially on those other dimensions of diversity, on doing some more data analysis of the data that we do have, proposing some ways of collecting that data in the future for consideration, including this question of lived experience versus cross-cultural experience, and then finalizing all that after we get some additional feedback and guidance from all of you on the board in August. And our goal is then to present the final findings and recommendations with a proposed implementation plan at the board meeting in October. So I will end there and see if there's any questions or comments for either myself or Susan.
Great. Thank you so much, Ignatius and Susan, for your presentations this morning. And thank you, Susan, for hanging in there with our technical difficulties at the beginning. I just also wanted to acknowledge, I see there's a lot of lead committee staff as well as the work group on today's educational webinar, and just to thank and recognize all of their hard work and dedication in this project, as well as Susan and Ignatius's work. So thank you to you all. It's very much appreciated. And at this time, I'd really like to turn to the board members to see any initial thoughts or questions that you have on today's presentation. We want to make sure that you're familiar with the content and that we have prepared you for the upcoming August board meeting, where we'll be looking for more formal feedback. So anything that we can address or speak to, I certainly welcome those thoughts and comments. And then once we've heard from members, we can see if there's other folks on the line that have questions or comments to share. Michelle, you can go ahead. Oh, yep. Thanks for turning off the slides. And members, you're welcome to unmute yourself and share or raise your hand, or if anyone has questions or comments, you can always drop that in the chat box to me as well.
Go ahead, John.
Yeah, I just want to say this has really been a great process to be part of, and I've learned a lot from it. One aspect that Ignatius, you brought up a couple times that I think could be helpful to us is you've mentioned trust. And I think expanding on that a bit to help us understand, what elements build trust, what elements undermine trust when it comes to this process would be helpful for me. I'm just so impressed or depressed these days about the challenges in building trust when it comes to health. So I thought it was great you used that word and brought it up, and as we go forward, teaching us more about that would be helpful, I think.
Great, thank you for that comment, John. And maybe just to give an example, I promised the stakeholders that I would keep their comments anonymous and not attribute them to anyone, but one stakeholder that I reached out to, which you would probably all recognize, said this is the first time anyone from OHA or on behalf of OHA has reached out and asked about these issues. And so just feeling like there wasn't that relationship there, and they were eager to help and eager to engage, but just hadn't. And so that's not the fault of anyone at OHA, but it's just that systematic lack of engagement and relationship that, again, shouldn't be the responsibility of any one individual, but should be approached in a much more systematic way.
I'll pipe in. Thank you, Susan and Ignatius, for the and all the other people who contributed as well. I really appreciated the information presented today. I really am excited about the idea of OHA pursuing a kind of centralized recruitment body that's not duplicative and therefore less onerous. And I imagine that, or I picture that as being more respectful of the and effective. So I'm excited about that. It was, coming off of our challenges in HITOC recruitment of getting representation from the Latinx community. It was both like, oh, it's not just HITOC's problem, but it was also like, oh, it's a broad problem across our work here, that we don't have that representation, I think, adequately. And so I can't help but wonder why, and I assume this is part of the job that y'all are doing here, and so I appreciate digging into there. And then you mentioned this, and I don't know if this is part of the August meeting, and I assume this work just will evolve over time, but I think recruitment is the right question, but then you also mentioned retention. And I'm equally interested in retention and participation, and this being I don't know, rewarding and active experience for everyone. And so what are the changes that we need to make to make that, when someone joins the board, to make it successful going forward too? But really appreciate this work, and thank you.
And absolutely, and again, that's the kind of thing we'll also look to each of you who have served on numerous boards yourselves, and have some good suggestions and recommendations of best practices. And again, I think it's not just a staff responsibility, but as I said, it's also a leadership committee leadership responsibility to really make sure that members are participating, feeling included, feeling heard. And there's many things that chairs and other committee members can do to support their fellow committee members. And so a lot of those recommendations will be included in the final presentation that we make in August, or the presentation that we make in August. But again, we'll look to board members yourselves to add and enhance to those as well.
I'll echo in Tara's compliments and that of my colleagues around the impressive work that you've given us today. So thank you very much for that. And it's been a pleasure to watch it unfold. I'm super interested, not just in the August final report, but the presentation that you alluded to in October. I wonder if you might give a moment or two to that additional detail. One of the, and by that, I'm asking for specific context to help this board and our committee structure stay the course. We know this is really big, heavy lifting work, and I'm excited around the action orientation for our efforts moving forward. So a little bit more detail on what we might see in October would be helpful. Thanks.
So I would say, after getting some additional input and discussion at the August meeting, Brenda, what we envision is really the tools to make this actionable. So, standardizing the data collection, and then standardizing how we're going to report on that data. And there's still a lot about how do we maintain a degree of confidentiality if that's appropriate. Do we report committees as a whole? Do we report committee by committee? How often do we report? So all those details we'll have to figure out, but we'll make recommendations in October about that. And then I think to Kristen's point about retention and some of the inclusive practices, again, more specific recommendations to both staff and committee leadership about things that they could implement pretty immediately to move towards more inclusive practices. And then I think the final piece of action will be some potential recommendations for statutory or charter changes, so that, again, in this process of simplification, but also alignment and coordination, do we have to actually revisit some of those issues? And then potentially even some resource allocations issues as well, that it's always, there's the work of these committees, and then how do we make this diversity, inclusion, and equity work also the work of these committees, rather than feeling like it's an add-on or something that's separate.
Thank you for that. Just in follow-up, and as we prep for our August presentation for the board, it might also be helpful for the work group to point the board toward actions we can take that will help model the way. We're a relatively small group. We've asked for this. We live it. We embody this notion, and this is what we want to be more of. So if the committee can say these are the things that would be most helpful for the board to do and go first, I think it may symbolize something for the other committees, as we move forward. So just encourage you to take those risks with, of course, board leadership and support. David, I'm looking at you on my screen right now. Yeah, thanks for that.
Thanks so much
Let me
for
tag my thanks, Susan and Ignatius. Really appreciate the presentation. This is great progress over a relatively short period of time, and we'll keep on going. And thank you, Brenda and Kirsten and John, for your comments, and we'll push forward.
Great, thank you, David. Also, I just wanted to make sure that we had a chance to make our way through all the members that I see listed here on the participation list. I just want to check in with you, Oscar, if there are any questions or comments that you wanted to share before we conclude this morning.
I just wanted to thank Susan and Ignatius and everybody involved for all this really great work, to really great environmental scan and analysis. And I'm really excited to read the report and provide more recommendations on how to keep this work moving forward. So thank you all for all your great work and attention to this.
Thank you, Oscar. And thank you to all the members and all of those who have joined us this morning. I think we've heard loud and clear for the August presentation. You want some more details on those action items, and I'm just holding back because there's so much here that we've thought of and that we want to share. And I know the committees are eager to get started on those action items. So we'll be hard at work in the next couple of weeks to make sure that you have those details. And we look forward to your feedback. And again, today's recording will be available on the board's website this afternoon. If there are any additional questions, comments, please always feel free to direct those to me. Again, thank you for joining us and have a great day. Take care. Bye.